Today on The Beat, we are joined by Gastroenterology Associates of Columbus and Starkville. Today I'm joined by Doctors Ricky Johnston and Richard Hurd. And something that I hear so often, the importance of being screened for colon cancer. We've talked to you about this before. We've talked about age differences. I'm so curious to hear this year what we know now that we didn't know last year.
I wouldn't say a whole lot has changed, but I do think that this is typically an evergreen topic for us, and coming up with February, early in March, is Colon Cancer Awareness Month, so we always like to bring it up and kind of remind people. A lot of our viewers have probably heard about it or even done this before, but some haven't, and some may have family members that haven't, so we always like to spread the word about how effective and important colon cancer screening is.
Absolutely. I've got two close friends that are under 40 that are dealing with colon cancer, and so that would be my first question. I remember when I turned 50, that was the age. Mm-hmm. So what age should somebody get screened?
Well, what your friends are going through is a trend right now, and it's been a very scary trend, is that we're diagnosing colon cancer younger and younger and younger. So much so that they changed the guidelines from 50 to 45 is when we start colon cancer screening now. 45 is if you're not having any symptoms. You know, if you're having gastrointestinal symptoms, talk to your doctor about that. It might be something that needs to be screened earlier.
And then what about if I have a family history? Does that change the guidelines as far as age?
It does, and generally only first-degree relatives, and some people they think, well, I had a great-grandmother that had it, I need to go ahead and get mine when I turn 30, and that's not always the case. So generally, if you have a first-degree relative that was diagnosed at a younger age, not young, but less than 60, then they should start screening earlier at age 40. And then, or if you have two first-degree relatives that had it at any age, you can start earlier than 40. But in general, that's something we could handle. If somebody's got a family history and they have any concerns at all, they could give us a call and we could talk them through it. But I think it's very important to know your family history and remember that, because I remember when I first moved to town, I had a young gentleman who's got diagnosed with metastatic colon cancer in his early 40s. His dad had colon cancer, and he knew he needed to get a colonoscopy at some point, but he didn't realize that he was supposed to have done it earlier. So, you know, we would have liked to have seen him about 10 years prior, and you know, that would have been a point we could have really helped him out. So know your family history and talk to us or your doctors about it.
So talk to your doctors, know your history.
And another point, so if you are also supposed to start 10 years younger than your relative was diagnosed.
Yes.
Interesting.
So if you had a relative who was diagnosed with colon cancer at 38, you're not supposed to start at 40, you're supposed to start at 28.
Yeah.
And talk about that, when people are screened and you can catch it early.
That's your chance to cure them and our biggest impact. And I'll tell people every day, you could have colon cancer and not know it. And we get asked about symptoms a lot, and certainly there's some symptoms such as bleeding and change in bowel habits and belly pain, but you may not have any symptoms. I mean, you could have colon cancer and not know it. So definitely, you know, you catch it before it's had a chance to spread, and I mean, it can be a curative surgery.
And we'll talk very briefly, we have only a little bit of time. It is a painless procedure. It is a quick procedure.
Yeah, it's very quick. I mean, you know, if everything's normal, it takes us 15 or 20 minutes to do a colonoscopy. It's not a big deal. The hardest part's probably drinking the colon cleanser.
Right. Yes.
Everybody loves that.
Yes.
But, you know, that's doable as well and not too big of a deal.
And it's not something you have to do that often. And we remind people, you're doing this, you know, if you have a history in your family or polyps, you might be doing it every 3 to 5 years. If you don't have any polyps, it's every 10. So it's not like you're having to do this every year. So, you know, it's miserable, but you do it and you move on, and you're happy it's out of the way.
Exactly. Great advice. Thank you so much. And please see the information on your screen for how to reach the doctors.